primary healthcare system. They're there for everyone.
You know, before independence, you could probably say that it was health services for the minority, mainly those in towns. Whereas now we are looking at it as health for all throughout the country, with a particular emphasis on those in rural areas who had nothing before independence or very, very scarce health services.
Dr. Ameen Nashar, Deputy Minister of Health.
People who needed to be saved didn't either have the means of transport to get to the health center or health unit, or even if they have the means, that center was not there and they couldn't get in time. And most of the cases, even those who had the means to come to the main hospitals in town, usually arrived too late. And one of the objectives of primary health care is to save people on the spot and then refer them when they're in a better position to move, if they could not, of course, be treated on the spot. The same thing with malaria. Malaria kills many, many children and adults, and young adults in particular, simply because malaria is not stable in the country. It exists with higher prevalence in some areas and with low prevalence in others. And we have been getting a lot of people dying of cerebral malaria. The same thing with the other infections, pneumonia, tuberculosis, and so on and so forth. Simple diseases which could be treated on the spot without necessarily even having a doctor. I mean, you could train anybody who could read and write and who could handle a few items of medicine, how to diagnose early and how to treat also early. Our priority is to save probably the 80, 90, 95% of the population and not the 1 to 2%. Now, that will become a priority in a developed society where they have been able to overcome all the communicable diseases, all the diseases of malnutrition, all the infectious diseases. But these are still killing thousands of lives every year, and we can treat them without necessarily having sophisticated medical equipment or even the ivory towers of the teaching hospitals. We can still treat them in tents, in very, very simple health units. And that is primary health care again.
On May the 19th, 1981, the news in the village of Marib was that Mohammed Saif was home, still weak, but out of danger. Without primary health care, Mohammed would probably have been one of this year's child mortality statistics. Salah Hamshali is one health guide in one village, in one country. Yet the day when every community in South Yemen has at least basic health care